Good morning, everyone. My name is Shrijana Thapa, and today I will be doing the presentation on update on adjuvant treatment in resectable non-small cell lung cancer and potential biomarkers predicting post-op relapse. As we all know that the non-small cell lung cancer can be classified histologically, and molecular subtyping have been going on, and broadly it is classified into squamous cell carcinoma and adenocarcinoma and others. And in molecular subtyping, we all know that they have genetic changes on KRAS, EGFR, ALK, ROS, BRF, RET, HER2/neu. And we know that 60% of the lung adenocarcinoma have these kind of mutations, and these mutations are thus utilized for the further targeted therapy. Among them, I will be discussing two of the major driver oncogenes. First is the EGFR, which stands for epidermal growth factor receptor. They are the proteins on the cell surface, and they signal cells to divide during growth in a controlled and regulated manner. And mutations in these proteins on the cell surface cause changes, which leads to the abnormal growth of the cells and division, leading to cancer cells formation. Another is ALK gene rearrangement mutations. ALK stands for anaplastic lymphoma kinase, which is a transmembrane insulin receptor and belongs to the tyrosine kinase family. It also helps in the regulation and growth of the cells, and the mutation in this gene causes cell cycle deregulation and abnormal growth of the cells. They are commonly found in young non-smokers and mainly Asian patients. These sites are then utilized as targeted therapy and further as a treatment of cancer in various kinds of cancers. These targeted therapies have proven to be treatment which can slow the cancer growth and destroy cancer cells. And they are often used in combination with other treatments prior to surgery or post-surgery, along with chemotherapy or radiotherapy. So I will briefly be discussing on the latest ongoing trials on adjuvant targeted therapy and immunotherapy. First one is the Alchemist trial. It stands for the Adjuvant Lung Cancer Enrichment Marker Identification and Sequencing Trial. They are a group of randomized control trials for patients with early stage non-small cell lung cancer whose tumors have been completely removed by surgery and or other. They are all phase 3 clinical trials, and all of them are ongoing trials, and the sponsor is the National Cancer Institute. The objective of the Alchemist trial was to find out whether adding targeted therapy or immunotherapy based on the genetics of a person is helpful to prevent cancer after surgery or not. Its primary endpoint was disease-free survival, and secondary endpoint was overall survival, as well as to check the safety and tolerability of the therapies. The rationale behind undertaking this trial was that the EGFR gene mutations are found in 10 to 15% of non-Asian non-small cell lung cancer patients and almost 50 to 60% of the Asian patients, whereas the ALK gene rearrangement affects 5 to 6% of the non-small cell lung cancer patients. There are mainly 4 components of this Alchemist trial, starting from the screening trial, then the Alchemist EGFR trial, which targets the EGFR mutations on the tumors. Another is Alchemist ALK trial, which targets the ALK rearrangement mutations in the tumor. Another is Alchemist immunotherapy trial, which tests immune checkpoint inhibitors. The Alchemist screening trial, it was to identify the potential participants who have either of the 2 gene mutations, EGFR or ALK, in completely resected non-small cell lung cancer. They should have undergone R0 resection and includes from stage 1B, that is tumors of greater than 4 centimeters, to stage 3A patients. And approximately 6,000 to 8,000 of the patients will be tested for the screening of this trial. All patients will be monitored for 5 years. If the sample of the patient is positive for either of the EGFR or ALK, then the patient is asked to finish the scheduled treatment after discussion with the doctor. Then they are, if positive, then they are assigned to the arm which has received drug designed for gene change versus observation and follow-up by their doctors. Meaning one arm of the patients will receive the drug, other will be a placebo. And patients will receive drug on Alchemist trial for 2 years, but if the patient cannot for some reason further undertake the participation of this trial, then he can be stopped. However, if the sample is negative for EGFR or ALK, then the patient is asked to participate in the Alchemist immunotherapy trial. And then further they are again grouped into the immunotherapy group versus observation and follow-up group. So this is the basic scheme of the Alchemist trial. Around 6,000 to 8,000 of the patients will undergo screening. The patients should have R0 resection and including from stage 1B to 3A, non-small cell lung cancer. Then after complete resection and their treatment, either adjuvant treatment with or without radiation, after that the patient's tumor will be, the tissue will be sent for genetics examination, especially for EGFR and ALK group. If they are negative, then they will further be sent for immunotherapy trial meaning the tissue will be sent for PD-L1 tumor expression. If they are positive, then they will be assigned to either EGFR mutation targeted therapy or ALK rearrangement targeted therapy. So it's 4 months. So this is maximum duration. Minimum duration that was mentioned was 2 weeks till randomization. From surgery till randomization was minimum 2 weeks.
9 months. So when the question comes, the maintenance duration has to be.
The drug used is crizotinib, and it is given adjuvant orally, BD, on days 1 to 21, and it is repeated every 21 days for 2 years. And the study is still recruiting the patients and was started on 2015 March and is estimated to be completed on 2036 May. And total number of participants till now is 168. The key findings up till now is that it shows significant improvement in progression-free survival in patients receiving crizotinib as compared to the placebo group, with expected median overall survival of 99 months on crizotinib versus 66 months on placebo. Another is Alchemist EGFR treatment trial, where the eligibility criteria is similar to the previous Alchemist ALK treatment trial, except that the tumor will have EGFR mutations present and the drug used will be erlotinib, which is given orally. The study is also active but not recruiting any patients, and it had started on 2015 Feb and is estimated to be completed on 2026 October. The key findings of this trial was that the sample size is set so as to demonstrate superiority to placebo, that is 7.5 years versus 5 years of median survival in favor of the Alchemist EGFR drug. In Alchemist nivolumab immunotherapy trial, eligibility criteria is similar to the previous trial, and the tumor should express PD-L1 gene. The drug used is adjuvant nivolumab, also known as Opdivo, which is given IV over 30 minutes on day 1 of each cycle, and it will be repeated every 4 weeks for 1 year. Study is active but not recruiting the patients, and it had started on 2016 and is estimated to be complete on 2025 December. And findings up till now is that the nivolumab group had statistically significant improvement in disease-free survival compared to placebo, but final results are still pending. Summary of the Alchemist trial is that it represents a significant step forward in lung cancer treatment, and it has the potential to change standard of care for early stage non-small cell lung cancer. Other adjuvant trials on EGFR and ALK and PD-L1 are ADORA trial, which is also done on patients who have undergone complete tumor resection from stage 1B to 3A non-small cell lung cancer, and primary endpoint was to check the overall survival with osimertinib in resected Nsclc. It was a phase 3 trial checking the EGFR mutations in the tumor, and the Nsclc, the patients received adjuvant osimertinib of 80 milligrams for 3 years versus placebo after complete resection of the tumor. And its results were that the overall survival among patients with stage 2 to 3A was 5 years overall survival was 85% versus 73%. However, when the overall survival, if the stage 1B was also included in this trial, then the 5-year overall survival increased to 88% versus 78%. Another trial is the ELENA trial, which is also a phase 3 randomized controlled trial done on similar patients who have undergone complete resection stage 1B, 3A, and these patients received adjuvant alectinib for ALK positive patients, and they received 600 milligram of alectinib orally for 24 months versus chemotherapy in the other arm, who received 4 cycles of chemo as an adjuvant treatment. So results was associated with 76% lower risk of disease recurrence or death than chemotherapy arm. They concluded that in patients with resected ALK-positive non-small cell lung cancer, adjuvant alectinib showed a significant benefit with respect to disease-free survival as compared to adjuvant platinum-based chemotherapy, as well as low-grade safety profile with few discontinuations due to adverse events. Another is a keynote trial, which was completed on 2022. It is an adjuvant immunotherapy trial. It is a phase 3 trial, and it had 2 arms, where one arm received adjuvant pembrolizumab intravenous 200 milligrams versus in another arm they received adjuvant chemotherapy after surgical resection. They gave 4 cycles of chemotherapy, and the result was that the adjuvant pembrolizumab had improved median disease-free survival of 42 months compared to the chemotherapy arm, regardless of the PD-1 expression or not in the patients. Thank you.
So thank you, Dr. Shrijana. A few things that we would like to mention. That right now NCCN has said that for EGFR mutations, the osimertinib should be the gold standard. Right?
Yes, sir.
Before the erlotinib and gepitinib were, but right now osimertinib. So what I found is in this trial, Alchemist trial, the EGFR, they have said that they will include the erlotinib. The drug of choice is the erlotinib. So I don't know what biasness is there, because as of now the standard protocol is to start with the osimertinib. So maybe there will be the findings, the results will be maybe biased or inferior to what we have got achieved with osimertinib. We are not sure of it. Though the previous results have shown that erlotinib and gepitinib are the first generation drugs, and they have to be used. So there is one biasness, I think, in that Alchemist EGFR trial, right? This one. The second thing, very important point, is we can never use the immunotherapy plus TKI. If somebody has got the TKI positive, the EGFR mutation positivity, then we start with the TKI rather than the immunotherapy. We don't combine immunotherapy plus they're mutually exclusive. Either we use immunotherapy or we use TKI. So it has been shown that positive TKI has to be done. This is also another very important point. The third thing that they have mentioned is when we need the chemotherapy also, when do you need to combine chemo with the TKI? Sometimes we can use TKI only. So if right now what's done, that early stage cancer, like for example stage 1 cancer, those patients may not require chemotherapy. It's not necessary for them to have the adjuvant chemotherapy. But if they have got the molecular markers positive, then we start on the TKI for 3 years, like example the osimertinib. This is one thing. But the next thing, for example, those patients, stage 2 and 3, who require, according to the protocol, both the chemo and the TKI, then it is good to start with the chemo, then combine, followed by the TKI. But I'm not pretty sure right now they have been doing both simultaneously. I mean, they are starting the chemo also along with the TKI. So this question, I'm not sure. Can you address that question?
Sir, in this Alchemist trial, they've mentioned that patients should have completed their treatment. It can be either surgery only, surgery plus adjuvant chemo, or adjuvant radiotherapy.
They have mentioned the months also, right?
That's maximum duration.
The maximum duration that we need to start with the chemo. So what happens, for example, if you are receiving for adenocarcinoma chemo, then they will continue on maintenance chemo pemetrexed for at least 1 or 1.5 years. So what they have mentioned is what are the maximum duration that when they start with? Is it 1 year?
So 4 months.
Can you go back to the slide?